It's pretty well known that women will seek and obtain abortions, whether or not they are able to do so legally and whether or not they are able to do so safely. And we've talked a little bit about the recent restrictions in Texas on abortion clinics, which have resulted in a dwindling number of safe abortion sites from 48 down to only 18. This makes it even more difficult for women, especially women who are poor, especially women who may not be able to drive 30, 40. I mean, in Texas, could even be 100 miles to the closest abortion clinic. It makes it so that those women are endangered. And now, exactly as expected, completely predictable, Texas women are turning to alternative methods. And that is a term that is, well, we'll talk about that term. The Texas Policy Evaluation Project is a research group based at University of Texas. They've been tracking the state's reproductive health policy over the past 4 years, and they put out some information on abortions in Texas to show that if you make it more difficult to get to an abortion clinic, you don't really prevent abortions or keep people safe. Let's take a look at the findings, Lewis. Among the results, somewhere between 100,000 and 240,000 women of reproductive age living in Texas have tried to end their pregnancies entirely on their own without medical assistance. Think about what that means, okay? Also, the study found that a majority of women were poor, so disproportionately impacting poor people, and a majority of those women were Latina and lived close to the Mexican border, and a majority of the women said that they would have rather gone to a clinic to have their abortion, which means these are not women who are saying, well, I would be having my abortion in a back alley no matter what services were available to me. The women are being very clear that if there were legal and safe facilities to go to, they would go there. Is this at all surprising, Lewis, that this is how the shutdown of these clinics is impacting women?
It's happened in other states. I don't think the politicians care because they think that this should not be happening in their state legally with government money.
Right. Which it doesn't, because it's already, you already can't put federal funding towards abortion.
Yeah, but you can still have funding that goes towards the businesses that also provide that.
Sure.
And so that they think that they had their job is done. They did a great job and they won.
What doesn't reduce the number of abortions? Closing abortion clinics, for example, okay? Making abortion illegal, for example. Teaching abstinence-only sex education. Preventing access to birth control and contraception. These are the things that right-wingers want. What actually does prevent abortion? Well, most people who want to have an abortion are pregnant. So if you prevent pregnancy, you prevent many abortions. Reasonable sex education, thus, goes a long way to preventing abortion. Access to and education around contraception. Access to affordable medical clinics and not 80 miles away. These things help reduce the number of abortions, and they're all the policies that the so-called pro-life crowd opposes.
Yeah, it's I don't know. It's their moral mission, and I don't think they care about the consequences as long as they achieve just that.